Hello everyone. Today we will talk about the prosthesis. I am Dr. Ashish Somani. A prosthesis is a device that replaces the body part. Prosthesis can be internal prosthesis or external prosthesis. Internal prosthesis, for example, we have mitral valve prosthesis, total hip replacement prosthesis, total knee replacement prosthesis. External prosthesis, they are used after the amputation surgery. Here I have shown you the mitral valve prosthesis. Then this is the total hip prosthesis. This is the acetabular component, this is the liner, this is the femoral head, and this is the stem. Total knee prosthesis, this one is the femoral component, this is the patellar component, this is the insert, and below that is the tibial tray. Above knee prosthesis, basically it is a quadrilateral socket prosthesis. This is commonly used for the above knee amputation. So what is the structure of the above knee prosthesis? Quadrilateral socket prosthesis basically has a four part. It has a suspension, socket, prosthetic extension, and terminal functional device, or it is simply called functional device or terminal device. Suspension is the part of the prosthesis that holds socket to the stump. It is generally a leather strap that winds around the torso and the socket. The socket is the most crucial part of the prosthesis. It provides the comfort, support, and the control. It acts at the interface between the residual beam and rest of the prosthetic limb. Socket distributes the weight and the pressure between the residual limb and the rest of the prosthetic limb. Then prosthetic extension. Basically, this comprises of substituted bone. For example, femur and tibia in this case, along with substituted joint, that is knee joint. The prosthetic extension finally ends in the terminal device. Terminal device is also called as terminal functional device. Example, foot in the lower limb or hand in the upper limb. This is the functional component of the prosthesis. So this is basically a quadrilateral socket prosthesis. This one is the suspension. This is leather strap that is used to attach to the body. So this is the socket. Then this is the substituted femur. This is for the substituted tibia. This is the keel, and this is the terminal functional device. Below knee amputation. For below knee amputation, we use the patellar tendon bearing prosthesis. Patellar tendon bearing prosthesis is a type of below knee prosthesis where socket is designed to transfer the load from the residual limb to patellar tendon, tibial condyle, and other pressure tolerant areas. Natural knee movements are allowed by PTB prosthesis can lead to more efficient and the functional gait. In this diagram, you can see the patellar tendon bearing stump. This is a lateral supracondylar part. This is medial supracondylar part. This is molded for the tibial tubercle and the patellar tendon. So this is for fibular head. This is lateral tibial condyle. This is medial tibial condyle, and this is distal tibia. This is the popliteal depression. This is for medial gastrocnemius and lateral gastrocnemius. In case of Symes amputation, here the foot is removed from the ankle and the heel pad is preserved for weight bearing, and this type of prosthesis is used in the case of Symes amputation. Then Canadian prosthesis. We use Canadian prosthesis when we are using the surgery like hip disarticulation. So entire limb is removed from the hip. So this is the diagram of the Canadian prosthesis. Then in partial foot amputation, we use shoe fillers. Then we will discuss about the types of foot. Sach foot. It is a solid ankle cushioned heel It is devised by the University of California. So it has a keel. Keel is the bottom part of the ship. Literal meaning of the keel is the bottom part of the ship. So in prosthesis, keel is where the prosthetic extension sits on the terminal device. So basically it is a joint between prosthetic extension and the terminal device. Such foot has a rigid keel. No movement is possible theoretically, but cushioned heel using separate block of material for wood and rubber for heel and forefoot and sponge rubber in between will allow the certain degree of dorsiflexion, plantarflexion, inversion and eversion. This is pseudo plantarflexion and dorsiflexion movement. So such foot is more durable. So this is basically a diagram of a such foot. Here I have shown what the literal meaning of keel is. Keel is the bottom part of the ship. Now we will discuss about the Jaipur foot. It is devised by Dr. P.K. Sethi from Jaipur. So this type of foot has a flexible keel. Patient can have barefoot walking, can sit cross-leg and can squat. This is a low cost made from the readily available material like rubber and plastic and wood. Jaipur foot looks more natural. Time magazine has recognized it as one of the 50 best innovations in the world. Because of its flexibility of the keel, it is less durable. Then bone anchored prosthesis. Here the metal implant is directly attached to bone of a residual limb. This provides a secure connection for the external prosthetic limb through a process called as osseointegration. This eliminates the need for the traditional socket based prosthesis. Here in case of above knee amputation, you can see the distal femur, and here the prosthesis is directly attached to the bone through a process called as osseointegration. So need of the socket is totally eliminated. Vishapala, the earliest recorded use of the prosthetic in limb history. The Rig Veda, one of the oldest Hindu scripture. There is a story of Vishapala, a female warrior who lost her leg in the battle. The Ashwin twin deities associated with the healing are said to have replaced her lost leg with the prosthesis iron leg. This allowed her to return to the combat. This account is considered one of the earliest mention of the prosthetic limb in the history. Thank you.